Hello and welcome to One on One. I'm Vernon. We continue our conversation today with Hanif Benjamin, who is a clinical therapist and trauma specialist with the Center for Human Development Limited. We didn't go anywhere, but I feel obliged to shake your hand again.
Yes, and indeed.
I was just telling you before we came back on that I really admire your passion for the subject, the fact that you really do genuinely seem to care about dealing with some of these issues that are affecting our nation and keeping us back.
And I think that the passion is that I always tell people that this is not a job, but rather a calling, you know, and I think too many people suffer. Our children are suffering, and seemingly there is no help in sight. And if there is help, it is very segmented and very limited. And I feel as if we have an obligation to help our children, to help our nation, to help our people, because people are hurting. And I always revert to Martin, who said, hurt people hurt people. And so the cycle of violence, the cycle of pain goes on and on and on. So for me, it's you know, getting up every morning to really get this done. My team and I, you know, who are equally as passionate as I am, you know, to really go out there and make a difference in people's life, not at the surface level, but we need to get deeper inside. We need to go down. We need to have the tough conversation. We need to ruffle some feathers a bit. But at the end of the day, the result, what we want is so that our children can have a better life.
I think it's important for people like you and people like Renee Cummings, for example, who speak out, that the public gets a little more educated on some of these issues. Because to me, a lot of the problem is a lack of education on subjects related to mental health. And I'm wondering, and perhaps you may know the answer to this, is there some sort of socioeconomic connection there, that people who are better educated and better off socially and economically, whether they would tend to be more willing to look at their mental health issues than somebody who has not been educated thus far?
And there is a correlation, there is a definite correlation, and there are many other correlations that we can also look at. But the one that you spoke of, you know, it's easier if you are well educated and you know, socio-economically, you know, balanced. It means then that you can afford the best treatment. You can go to the private institutions and not be seen or heard. So
you can sort of avoid the stigma to some extent.
Correct. So you're not really dancing in the public party, if you would, right? You are having the backdoor treatment kind of thing, as opposed to other people who cannot afford, because psychiatrist is not a cheap thing, and it's not a one visit either, right? Sometimes you have to see a therapist for 10, 15, 20 sessions. So it means then that for a person who cannot afford that and have to go to the public, that means your business in the streets, right? And I'm not saying that because it's a public system, your business will be in the street, but because you have to now be treated in a backdoor scenario in a private institution, so you now have to face this, right? You have to get a time off from work. What are you going to put on your sick leave? You know, what is going to be said?
That's another thing, another area where education is needed, is that employers need to not stigmatize their employees if an employee says, listen, I have to go for therapy or something like that, to hold it against them.
Of course, because then immediately you're looked upon as less than. Immediately you are seen as a person who cannot do the job. And you have been doing the job for 20 odd years. How many odd years? And because you have a mental illness, they say to you that you cannot do the job, or they look at you as less than. And I'm saying to people, mental illness, cancer, leukemia, it's all illnesses. And we all manage it and we all deal with it. So why can't we deal with mental illness? Why must we turn up our face when it comes to mental illness?
Because to some extent, I think in our society, we look at people as who don't have the coping mechanisms as inferior because the rest of us manage. Whereas we don't really know how that person is wired to deal with things, the background they come from, how profoundly that whatever trauma may have happened affects them.
And you pointed out a number of great things, and I like how you mentioned trauma, because again, too often people who are living with mental illness started out because of some form of traumatic event. Some people just have the genetic makeup and they get mental illness because of the genetics and the hereditary and stuff, but some because of a traumatic event which would have triggered what we call secondary adversities. You see? So now they're living with this trauma, and not knowing how to deal with it develop mental illness. So you're talking about depression. Person may not have been depressed all the time, but because they was involved in a vehicular accident and they probably lose a limb or something, they no longer can work, so they feel as if they're not capable sometimes. And a lot of times you find families splitting up, the husband or the wife leaving because now you're no longer what I envisioned, what I wanted.
And it can be difficult to live with someone with certain mental illnesses. I mean, acute depression, for example, can be very difficult to be around when the person is in one of their deep periods.
It is, and you feel hopeless as a caretaker, as a person in the social environment, because the symptoms that goes along with that level of depression is, people don't want to bathe, they're no longer interested in life, they're locked away, they lock up all their friends, they don't want to eat, they probably turn to some form of substance, right? So it's a lot of compounding issues on trauma, and that is what we call how complex it is. And so therefore the social environment is not able to deal with that amount of pressure. So they too start to suffer from acute stress disorders, right? Anxiety. They no longer can sleep now. So you have a stumbling or tumbling blocks of a plethora of problems, not only for the person who is living with the mental illness, but the social environment that supports. And that is why we have so many displaced people in Trinidad and Tobago. Because when you talk to families, not that I want my brother, my sister, my father, uncle, aunt to be on the street, but we just don't know what to do. And, in the first segment, we were talking about St. Anne's and stuff. And I say to people, St. Anne's is not a long-term, or it shouldn't be a long-term treatment modality. However, because people in the community have not gotten accustomed to the aftercare, that is where the problem is. So you would leave just like you go to the hospital, they give you your medication, your prescriptions, and they send you on your merry way. The hope is that you will fill your prescription and you will take your medication. And it's the same concept there. Because in Trinidad, we don't have that level of community mental health services where, unlike America, where I worked in the mental health arena, when you leave, you're leaving into an outpatient clinic who can follow you into the community, follow you into the school system, follow you.
So you're not just dropped and
so
make your own way.
So you wouldn't have to wait 6 and 7 months before you could be seen again. So you find people who comes out of St. Anne's, they're going to be good for a little bit, and then after long, you're back at the same situation. Why? Because you didn't take the medication, there's no therapy to support you, there's no coping skills. Unfortunately, you can't stay in St. Anne's forever, and they can't do all of those stuff. And that is why they need places like the center who can then come in and provide that medium between St. Anne's and the community. Who's going to help you with your normal therapy? Who is going to help you with medication management? Sometimes a parent say, look, I have all this medication, I don't know what it's for. And it's our job now to help that mother understand, well, this medication is for this. And that is why your child behaves the way they behave when they take this. Pull it up on the internet. Look at it with the parents. Give them printout. That is what we're about. Really educating people.
And you're also educating the families around these individuals to be able to handle the situation better.
Right. And I remember I'm working with this one family who child is on medication, but every 3 o'clock, the child goes into a state, tearing up the house. And the family could not understand. And nobody's explaining to the family, but when we look at the medication, we saw the lifespan, the daily lifespan of the medication. So if the child take the medication at 7, by 2 o'clock it's worn off. So now what happens? So now we have to help mom understand that when you go back to your doctor, you need to tell the doctor how the child is behaving and the timeline. But you see, if we didn't work with the mom, she wouldn't understand the timeline and look at those kind of things. Those are some of the things that we need to help people to understand. How can they manage themselves, manage their families without losing their hair, without them going into a mental health crisis as well?
So you provide support services, essentially, in addition to the primary services that you
Yes. Because we operate in what we call the social environment. We cannot treat someone in isolation. I want to talk to your doctors. I want to talk to all your past physicians. I want to talk to, if you see the church as your support, I want to talk to your pastor or priest, right? I want to talk to your mother, your grandmother, whoever is in that house with you. I want a family meeting. Because we cannot treat a person in isolation. Because it's easy for you and I to have one-on-one. But when you go home, what and who are you going home to? What are the triggers home that is helping you exacerbate your behaviors? And can we now eliminate those triggers? But the only way I will know that is how. If I were to interact with your members of your family, your circle, your social environment. And so we treat people holistically. It cannot be a one-on-one. It has to be you and your social environment. And we will provide the information, we will provide the training to your social environment so that you can better thrive. And you will realize that when that happens, medication decreases faster, you weaned off a medication, and your therapy is shorter. Because we don't believe in 2 and 3 years therapy. We believe you come in.
Oh, the Freudians will hate you.
Yes. We teach you, we guide you, we give you coping mechanism. Go forth. It's okay to come back. But how will I know that the work I'm doing with you is working if you are sitting in my office every week for 3 years?
Because then, to some people, it becomes a crutch then.
Of course. And then we realize that, are we really helping or are we hurting? Because then if everything happens, you call me on the phone, then it means then that I have not taught you anything. What I'm doing is just giving you an opportunity to talk. But I want you to go out there, practice what you have learned. If you fail, fine, we will readjust it to suit. But you need to go out there and practice it.
It seems to me that if somebody comes to you with a mental health issue, that you're basically telling them you're going to have to open your life up for a little while, because I'm going to talk to every single person around you.
Yes.
About whatever it is you're experiencing.
Correct. And what I also say to them is that I can help you talk to them, because a lot of people come in secret. And a lot of session might be just getting that person to open up to me. And then I can help them to say, you know what? You'd rather suffer in silence. I can help you find the words to say to your loved one, this is how I feel. Right? I had a client who tells me, well, you know, it's just me. I said, what do you mean it's just you? Well, you know, my husband, he busy, he don't want to hear about my suffering. And so I said, no, I can help you find the words to have a conversation. And the man came in and he was first in session. You understand? Mm-hmm. He was sitting on the chair first. He would come from work and he would be here waiting. Honey, where you are? I reach already. You know? So I'm saying to people, if we educate them, we teach them about it, we guide them through it, and it's not just come sit on my couch, go home, take your money, but it's a holistic approach to help you and your entire family strive.
It strikes me as well that the method that you use would also let the person know that there are others around them who genuinely do care.
Correct.
And are out there seeking their welfare and their benefit.
Correct. And in line with that, what we're also developing is group work. I have seen the power of group work. People coming together who are living with the same situation to provide support for one another. That is important. And we're going to be advertising some group work, and for whoever would like to come. You know, you don't have to be tied to any specific treatment, but just if you want to come to a 15-week support group dealing with certain situation, then and you come and we provide you with that solution-focused approach to really helping you to climb that hurdle, to move on to the next phase.
By knowing that you're not alone in dealing with
and
things.
I think that in itself speaks to the stigma. If you can sit in a room with 15 other people who is also living with bipolar, or is living with anxiety, or is living with depression, it makes you feel, wow, I am not alone.
And it's not, I guess if you're sitting at home with depression or you're bipolar thinking, nobody will ever understand the feelings that I'm feeling, and then you find yourself in a group with 10 people and you suddenly realize, oh, wait a minute, these other people understand the feelings that I'm feeling.
And strange enough, that sentence, they will never understand. That is a very prominent sentence. They will never understand how I feel it. Nobody knows how I feel. I'm all alone. Mm-hmm. And that is why you revert to your dark room, right? Because nobody knows. You believe, because that is the mental illness talking. But again, I have seen the power of a group where, like, wow, I am not alone. You mean you have been living with this as well? So it really opens up a door. And you know, all of that comes through our education, our training department, which is about really going out there and getting people to understand the mental health, understand trauma, understand why we need to learn about trauma, understand why and how trauma affects people and affect their behaviors. Because sometimes we are fighting against something that we have no control over. And it's our job to help people to do that. And I'm guessing that is why the first trauma workshop, and I was privileged to come.
We were talking about the event of the 16th, we talked about that already, and that's overcoming the stigma, mental health in Trinidad and Tobago. And then there's a workshop, which is looking at a very important area, which is trauma and children and adolescents.
Right, and this is a 3-day intensive workshop. And if you speak to anybody who was at the last workshop, they will tell you it was intense. You know, people say, I've never come to a workshop and not nod. There's no opportunity to nod. It's a lot of group work, it's interactive, it's powerful because it allows us now to see trauma in a different light. We are now able to see children and adolescents' behavior. You see, because we don't believe in bad children, you know, Vernon. We believe that children respond to circumstances and situations. And because of that, if you're able to appreciate the trauma that they have been or is currently going through, then you're able to adjust the way we approach them. You see, because we approach children and adolescents based on what we perceive to be normal. And it's not even normal because I tell people we are approaching children from a top-down approach because we are speaking down to them, right? And our approach is that we speak at a level so that they will hear us and they will understand us, and vice versa. Because I'll tell you something, our children speak to us constantly, you know. We are not hearing because they're not speaking the language we want them to speak. I tell a teacher, this child come in and cuss and carry on every Monday morning with only you. Means that this child is talking to you. Let us forget the cuss and carry on and decipher exactly what this child is trying to say to you. The child is trying to say to you that every weekend I'm going by my father's family and I'm being abused there. And when I come to school Monday morning, I'm saying this to you. But you see, we are so caught up in the behaviors that we're missing the why. And this trauma workshop opens that up to people. It opens up the why. It allows them to see and feel and experience why children and adolescents behave the way they do.
Because quite frequently they're acting out, aren't they?
Correct.
But it seems to me the same way we are dismissive of issues of mental health in this country or diminish them as being important, when it comes to trauma or kids acting out and behaving badly, as you mentioned, without us asking why, our first solutions are always, and I always say this, are to say they need more licks or they need more Jesus. One or the other.
Yeah. Right? And it's so strange that punishment also in the form of Jesus, right? Because again, you hold them by the pastor, pray for him because you know. So and the child sees that as a form of punishment, or you beat the living daylight out of the child, right? Or you're not disciplining them good enough, but we're not asking why. Again, we are constantly beating our children or disciplining our children for things that they might not have control over. Or because of behaviors we ourselves as adults taught them. Right?
So if a child's coming from a dysfunctional home, whether it's perhaps even violence, for example, and they go to school, you can't expect them to be behaving in a top-notch manner because they're going to be reflecting what they see in their own home.
Of course. You know, domestic violence. And a lot of times, parents say, well, nothing is happening with the child. It's me and your father, or whatever the case is. But I'm saying to them, it affects the child. Because if the child is seeing mommy and daddy dealing with conflict, with blows, when I go to school and Johnny doesn't want to do what I ask, or I'm having a problem, how am I supposed to address it? I will address it the way I have learned, which is what I've seen mommy and daddy doing. So I tell people, yes, it affects our children, right? And we want our child to go to school and do well for 8 hours and function. And I'm saying we're living in a fool's paradise. If we think that a child will go to school and function, living in this form of trauma, it's not going to happen. And yet we want to beat it into them and not understanding that we need to come from a place of understanding. And that is why this trauma workshop is here, to help people understand it, to get.
When is this one being held?
This is going to be the 1st to the 3rd of July. The 1st to the 3rd of July, 3
you
days.
barely have time to recover between.
Oh my God, yes, but it's all right because we're educating people.
And you've had some practice doing it.
Right, yes. So, and it's going to be held at the Radisson Hotel. I'm on Wrightson Road.
Formerly the Crown Plaza, I believe, yeah.
Yeah, it's going to be, again, 3 days. The registration information is online. Again, everything. We put up everything there. You would see the rationale, the 3 days, how it's laid out. Everything is there for you. So again, go up on our website, which is www.livelifewelltt.org. livelifewelltt.org. I would also give you the numbers if you so desire so that people could call because our people are also standing by. 224-3581, that is 224-3581, 317-3471, 317-3471, and let me just pull up the final number here, which is 374-9996. 374-9996.
And again, they can get those numbers off the website as well.
Yes, everything is on the website, the email, and we made it simple. You just fill out the application, the registration, and it comes directly to us. So
we have about 4 minutes left. One of the wonderful things about human beings is that we're all different.
Correct.
And that makes the world an interesting place. But somehow we can't seem to translate that into the fact that if two people are faced with the same trauma and one person comes away okay out of it and the other person is deeply affected, we have trouble understanding and think there's something wrong with the one person who's affected.
Right.
Like if somebody gets shot in your neighborhood and you're seeing it and two young people see it and one kid handles it, if you will, and the other one really starts developing paranoia and problems, that's perfectly understandable because they're all different.
But again, society has made it in such a way that move on, deal with it.
These things happen.
Yeah, these things happen. And strange enough, I dealt with a family with two young men who experienced the same trauma. One went on to do well at school and the other, tried to kill himself probably about 100 times to date. And people couldn't understand, one thing happened, but I'm saying to people deal with things differently. And there are a number of things that is responsible for that. Your social environment, your level of resilience, internal level of resilience, your support system, those things will help you to cope, right? Again, sometimes...
I guess our brains are wired differently
of
sometimes
course,
as well.
It's just how you deal with it. So, and I often tell people there is no set time to finish or to move on or to whatever the case is. Yes, there comes a time when moving on needs to happen, but for some, it might require an additional support, and nothing is wrong with that, right? Because you was able to move on at a faster rate than I was, doesn't mean that something is wrong with me. It means that I just need a little more time or more help in order to move on. So again, that is part of the stigma that drives people from showing their vulnerabilities. You see, because if I show my vulnerabilities, move on, you can't get no more time off. How much time off you need to deal with that? She done dead already, this happened already. So those are some of the statements we will get, but we're not understanding that what we have now is what you call implosion, because I start to suffer internally.
So you're pretending you've dealt with it, but in fact you just internalized.
And I
often... You see that quite often in this country when somebody passes away, for example. There's an almost bizarre expectation that you're supposed to get over it within some apparent time frame that I'm unaware of.
Yeah.
And then people say, well, you're just clinging on, right?
No.
You have to heal, you have to move on.
Yeah, and those are frustrating and annoying statements that I really can't deal with, because how are we dealing with pain and hurt? While we have the 5 stages of grief, nobody says that you can be stuck in one of those stages. Sometimes people are stuck in anger for quite some time, and it's up to us to help them through that. But because it's 5 stages, it doesn't mean that you need to go, okay, you have 1 month for stage 1, 1 month for stage 2. Rather, you move through it depending on how you can move through it. And for some people, they might just require a little help to help them through the stages, because they're still angry or they're still, in whatever stage they're in. But again, our stigma will not allow people to do that. So then you suffer internally. and then you building the anger and the aggression and the pain inside, and then what you have is this implosion, depression, anxiety. You're angry now, you're mad at everybody, right? Displaced anger. All of those things are signs that people are suffering internally when we are not allowing them the opportunity to suffer outwards.
So as a society, we're completely out of time. As a society, we need to allow people the room to sort of cope with things and deal with things themselves and not force timeframes on them.
Correct.
Because it may end up doing more harm than good. So just to remind people, Hanif, it's the event on the 16th is at Mount Hope, Arizona Medical Sciences Center in the auditorium. And that's on, once again, dealing with the overcoming the stigma of mental health in Trinidad and Tobago.
That's totally free.
Free?
Yeah, that is totally free.
I may even be there then.
Please come.
And the workshop is from the 1st to the 3rd of July.
Correct.
And that's at the Radisson.
Yes. That is a paying event. That is $3,000 per person. $2,700 if you register in a group of 3 or more, or $2,600 if you're an active student.
And clearly that's obviously aimed at professionals.
Correct,
who are
yes,
in the field. It's a pleasure, as always, having you on the program.
Listen, it was indeed a pleasure having this conversation with you.
We could have had 2 more interviews. Maybe we will someday.
Call me.
I'll let you know.
Just call me. I'm ready.
Hanif, thank you so much for being on.
Thank you for having me.
You've been watching One on One. Join us again tomorrow for another edition.